everyone, welcome back. Today I'm going to teach acid-base balance, and on a personal note, I'm in Tokyo right now, but this class is for my students in Brooklyn AMG College and all the other students who are interested. So acid-base balance being a little complicated, let's divide it into part 1 and part 2. Today I will teach you the basics, and in the next class we'll do some questions together in NCLEX and USMLE practice questions. So acid-base balance is dependent on the pH of our body. The normal pH in a human body should range between 7.35 to 7.45. So if the human body pH should be within 7.35 and 7.45 for all the cells to function normally, right? So that is physiology, that is homeostasis. To maintain homeostasis, the pH range should be between 7.35 to 7.45. So whenever you get a question, the first thing to look at is the pH range. Is it well within the range, the normal physiological range? Anything less than 7.35 becomes acidosis, which could be either respiratory acidosis or metabolic acidosis. More than 7.45 pH becomes alkalosis. Again, it can be respiratory or metabolic. Now, for acidosis, the biggest factor is CO2, H+. Now, why is CO2 acidic? That's because when CO2 combines with water, it forms carbonic acid, H2CO3. So, when there is too much of CO2 in your body, the pH becomes less than 7.35. That is, the body goes into acidosis, the pH drops. Now, let me take an example. When will CO2, carbon dioxide, accumulate in your body? So, we all know we breathe in oxygen, we breathe out carbon dioxide. Now, if we are not breathing out properly, there is some obstruction, say COPD, asthma, or a patient is post-op sedative, taking opioids, which causes respiratory depression, benzodiazepines, alcohol intoxication. All of these will decrease the respiratory rate. So there is accumulation of carbon dioxide, which can lead to acidosis. So those could be the examples of respiratory acidosis. Now, what will happen if there is, say, too much of CO2 being lost? Example, hyperventilation, you breathe out rapidly, so you are washing out carbon dioxide. You're losing carbon dioxide, meaning you're losing acid. So the pH goes up, so that becomes respiratory alkalosis. So again, I'm just talking about respiratory. We'll move on to metabolic later on. So tell me a condition where you are rapidly breathing. It could be hyperventilation due to an anxiety attack or a panic attack. Small breathing. So you're breathing out rapidly and washing out carbon dioxide. So what would you do? You can just ask the patient to breathe in a paper bag. So he's breathing in carbon dioxide, and that could return the pH back to normal. Now, moving on to alkalosis. Alkalosis, again, there could be respiratory and metabolic. We spoke about respiratory alkalosis causes such as hyperventilation, anxiety attack. Then moving on to metabolic acidosis. Now, metabolic acidosis, again, could be something related to the kidneys, where you are if you are not secreting sufficient or excreting H+, there is too much of H+ within the body. Or there could also be acidosis, metabolic acidosis in case of diarrhea, where you're losing a lot of bicarbonates. Similarly, there could be when you're vomiting out. We all know stomach has acid, HCl. You're vomiting out acid. So again, it can lead to metabolic alkalosis. So these are a few examples of respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. Now, in the next class, we will talk about the compensation, how it's compensated, whether it's not compensated, and how we solve these tricky problems. Thank you. Have a good day.